Hey there, Amy Demas with Communicate Excellence. Do you have any scheduling ninjas on your team? I sure hope you do. And if you cannot confidently answer that right now, by the time we're done today, I want to make sure that you are set up for success in scheduling. Today on Communication Timely Tips. Offering appointments to clientele and patients is a critical skill that we need to learn. We need to make sure that we've got the right mindset as well as the correct technique when offering appointments so that we can successfully and effectively offer appointments and keep people on track. So how do we do this? The first thing I want you to remember is you need the right mindset. This is not the time to confuse the customer service of politeness here. We need to be guiding. What we're not doing is being a doormat. When do you want to come in? And basically opening up our options for 24/7 and then allowing people to walk over us when we don't fulfill 24/7, 365 days a year. Our grids that have been made for us or we have created for ourselves are there for a reason. Here's the way I want you to think of yourselves. You are like air traffic control. And when you think of the relationship between air traffic control workers and pilots, who's doing the directing? It's air traffic control. They don't ask the pilots and say, when do you want to land? When do you want to come in? That would be sheer mayhem. One, we're putting lives at risk, but two, we've got gates that can never be pulled into, and so it is setting everybody up for even greater frustration. Air traffic control gives maybe the pilot one or two options or dictates when they're coming in. Now, we are not having to be as stern as air traffic control, but we need that mindset as we're offering. What we're trying to do is take the emotion out of the belly. And that's one of the things that tends to happen when we're not in that air traffic control mindset. We begin to put commentary in there. We say, I've got something, I don't know if that's too early for you. Is that just too soon? What do you think about this? Cut the commentary. We've got to remember we're dealing with facts. Just the facts, ma'am. And so how do we offer that appointment? Here's the structure. We need a statement phrase as we start it and a statement inflection as we end it. Here's what it sounds like. Dr. Smiles' first availability happens to be Tuesday at 1 or Wednesday at 2. Did you hear that? The doctor has, or the first availability is, and the ending ends with that inflection grounded and downward. 1 or 2. 1 or 2. Contrast that to a question phrase, question inflection, which would sound like this. Could you do? Would you be able to? And then it ends in 1 or 2. See how if we start off in that question phraseology, it sends us on the trajectory to end in a question inflection up there? Because that upward inflection implies, what do you think? So we've talked about questions and statements, but there's something in the middle, and I call it that middle wiggle, and it sounds like, was that a statement or was that a question? I may give you the benefit of the doubt that you were going toward the statement side, but for somebody who's wanting to control calendars, oh, there's my in. And it sounds like this. I have a 1 or 2. You hear that hang? I know how it happens. A lot of times when people are rescheduling, you're going down the grid and you go, I have a 1. Oh, I don't have another one. And you hang. Simply add a fact. I have a 1, and that is in our A office. I have a 1, and that is tomorrow. Add a fact to help close that back out as a statement. We have to isolate the facts of the times from the follow-up question of which one works. So a full one would be the doctor's first availability happens to be 1 or 2. Which one works best for you? Which works best? Notice also how that's put together. Which one is a leading question? And I'm going to put in the notes a link to another YouTube video on the 5 types of questions for your reference. Which one works best for you? Not, do either of those work for you? Which implies, I might have 100 more. All these things are going to help you offer these more effectively. What I need you to do is remember, you are the guide. Now, they may be able to make requests of you, but you are still in the guiding mode. So let's say you offer, I have 1 or 2. Which works best for you? And they say, we're out of town. Could you look on this day? I'm happy to look for you. And then you can offer what's available, but you are still guiding. But as soon as you give that control away, what day works best for you? Do you want morning or afternoon? You have now switched seats with them. And they are in control, and they say, we want this. Now you are saying, would this work for you? Does this fulfill your requests? You stay the guide. You are open to a request that they may have, but you've not put them in charge of what they are dictating to you. Because here's the thing. You are a predictor of how your day is going to run today, tomorrow, 6 to 8 weeks in advance. You are setting up the practice for ease of flow or for mayhem and bottleneck. Stay in charge. What do you do about those who are rescheduling? And I know many reschedule. You can still remain emotionally detached from that. You started off with, I'm happy to help you reschedule. What I'm going to do is look for that first availability to best keep you on track. Now when you offer what is actually a hole instead of trying to create a hole, you're simply trying to keep them on track, which may mean, all right, the first availability is tomorrow at 11 or 1. Which works best for you? And the patient or the parent or the responsible party may say, oh, can't I just slide over to 4:30 the next day? Here's the thing. You're going to say, I'd be happy to look for you. As we're in the middle of our rotation, that 4:30 availability may need to be another 3 or 4 weeks out before we find one, which could potentially move the finish line of treatment. Would you prefer for me to look there or what the doctor has prescribed? And then it's their choice. You have made them aware of the unintended consequence of their choice because life gets in the way. Life is real. And we are not there to arm wrestle them, but we've made them aware because you know as soon as you get to that estimated treatment time that we promised, they have an alarm going off that's saying, hey, when are we done? And we need to be able to have that breadcrumb trail that says, hey, Mrs. Jones, I see 4:30 was very important. And there were 3 or 4 times that we opted for 4:30, adding 3 and 4 weeks each time and pausing treatment. So actually we're tracking quite well. All these things are to help you remain the guide and a little emotionally detached. All right, so let's recap. Right mindset. You are a guide because you have the bigger picture. Second, structure. A statement phrase with a statement inflection at the end. And then you can use a follow-up question. If they ask a request of you, make sure they're aware, if they are putting things off in a far advance, what the impact or the unintended consequence of that is. Give these things a try. Let me know how you are now becoming a scheduling ninja. Have a great day. Bye-bye.